Hi guys and welcome back to the channel of The Dissected Truth. Today we are starting with liver. So, gross anatomy of liver. सबसे पहले basic things we already know. Liver is the largest gland of the body and it performs many functions. For example, secretes bile juice, stores glycogen. It also synthesizes some proteins that are present in our plasma. So plasma proteins, serum proteins, and lipids. It also detoxify blood from endogenous and exogenous substances. ये जब like lower classes में हम पढ़ते हैं कि there are many endoplasmic reticulums in liver cells जो detoxify करते हैं. They will get rid of drugs, toxins, alcohol, and everything. Got it? Then, if you remember, हेमाटोपोइसिस यानी ब्लड सेल्स का फॉर्मेशन कहाँ से होता है व्हेन वी आर इन लाइक एम्ब्रियो और फीटस. सो सबसे पहले इट स्टार्ट्स विद द योक सैक, उसके बाद लिवर एंड देन बोन मैरो. सो इट हैज अ फंक्शन of producing blood cells during fetal life. Cool. Now the main thing, liver occupies whole of the right hypochondrium, upper part of epigastrium, and a small part of left hypogastrium. And this is how liver is present. Whole of the right hypogastrium, upper part of epigastrium, and a small part of left hypogastrium. Got it? Then the main thing is that liver lies under the cover of ribs and the costal cartilages. So as you can see on the right side, its upper margin extends up to the fifth rib. Upper margin extends up to the fifth rib. On the left side, it extends till or up to the fifth intercostal space. And in the midline, the upper border is present at xiphi-sternal joint. The joint that is formed between the xiphoid process and the sternum here. That's where it extends. Okay? Then this is the lower border. It is in the midline, it is present in transpyloric plane. In the epigastrium, like if we divide it, like the whole thing, into 9 quadrants. So in the epigastrium, the inferior border extends from the 9th costal cartilage on the right side till the 8th costal cartilage on the left side. Are you following? Like, अगर मैं inferior border की बात कर रही हूँ, inferior border is the sharp border, very sharp border, and in the epigastrium, it extends from right 9th costal cartilage to left 8th costal cartilage. These are the extents. If you get everything. This one, fifth rib on the right side, fifth intercostal space on the left side, in the midline, xiphi-sternal joint, and inferior border, sharp. Inferior border is crossing the midline at the level of transpyloric plane. Cool. छोटे बच्चों में क्योंकि हेमाटोपोएटिक इसका फंक्शन है, सो इन न्यूबॉर्न Liver is much larger, occupying 2/5 of the abdomen, the whole abdomen. Uska 2/5 portion only liver is occupying. Let's move further. For the sake of simplification, हम ऐसा मानेंगे कि liver is a wedge shaped pyramidal, four-sided pyramid having these surfaces. Look at them. देखो ये pyramid है. This is a four-sided pyramid. This is the base on the right side. This is the superior surface, anterior surface, posterior surface, and inferior surface. By the way, ये सारे surfaces बताने से पहले liver is simply divided into two types of surfaces. Like liver का एक diaphragmatic surface होता है जो diaphragm cover करता है, and एक visceral surface होता है that is in contact with other visceral organs. Then diaphragmatic surface is divided into superior surface, anterior surface, posterior surface, and right lateral surface. The inferior surface, on the other hand, is the visceral surface itself. Got it? देखो, diaphragmatic surface and visceral surface divided into four other surfaces, and visceral one is the inferior surface only. Got it? Other than that, simple information that the size of liver in males is 1.4 to 1.8 kgs. In females, it is 1.2 to 1.4 kgs. In newborn, it is it is covering, or it is constituting 1/18th of the body weight. At birth, it weighs only 150 grams. The baby is also very small. So obviously at birth, it is 150 grams. In adults, it is occupying 1/40th of the body weight. Compare it with the newborn. Is it good? Does it make sense? Can we move forward? Also, liver का color होता है normal color, reddish brown in color. Fine. Let's move forward. These are some diagrams I need to explain. So ध्यान से देखो, अभी ये डायग्राम जो दिख रहा है इसमें हम क्या क्या देख सकते हैं. So this is the liver and we are looking at the anterior view. So we can see the anterior surface of the liver. This is the diaphragm that is pulled up. अब ध्यान से देखो, these are the peritoneal folds. This also. So in peritoneum, we have already discussed the falciform ligament, which extends like this. We also have this coronary ligament. The coronary ligament itself, when it comes to an end, on the left side it forms left triangular ligament, and on the right side it forms right triangular ligament. अभी ये सब चीजें और डिटेल में जाने वाली हैं. दिस इज जस्ट द बिगिनिंग. ये से स्टार्ट हो रहा है. प्लीज बी विद मी till the end of this lecture for a better understanding of liver. Fine. So the main thing I wanted to show you is this falciform ligament extending as this round ligament, also known as ligamentum teres. Here is the inferior border, which is the sharp inferior border. And in this inferior border, you can see two grooves or two notches. One is this. This is the notch for ligamentum teres. And one is this. This is the notch for gallbladder. So this is cystic notch. Is it good? Can we move forward? So this is the posterior view of liver, but ये थोड़ा सा उल्टा है, इसलिए I will prefer to show you this one. At least ये understandable है. This is the right side, this is the left side. Fine. So the main things I want you to see are, here is the groove for inferior vena cava. Here will be the inferior vena cava. This is the groove for gallbladder. This is the porta hepatis. जो तीन चीजें, portal vein, hepatic artery and hepatic duct that are present in this area. बाय द वे पोर्टल वेन और हिपैटिक आर्टरी लिवर में एंटर करते हैं, हिपैटिक डक्ट लीव द लिवर, बाहर निकलती है लिवर से. इज इट ऑल गुड? अभी और भी जो चीजें आएंगी आई विल एक्सप्लेन अलोंग साइड. सो लेट्स मूव फर्दर, in which we have diaphragmatic surface. The diaphragmatic surface, I already told you, diaphragmatic surface is in contact with the diaphragm. And it includes all the surfaces of liver except for the inferior surface, क्योंकि visceral surface inferior surface है. Fine. So simple diaphragmatic surface have two areas. One is the smooth peritoneal area, जो पूरा peritoneum से covered होता है, and one rough bare area which is devoid of peritoneum, which faces posteriorly, which I can show you. This is the bare area. This is the bare area of liver that is present posteriorly. तभी वो posteriorly दिख रहा है. And bare area of liver is bounded by coronary ligament at both the sides, like on the upper side and lower side, and on the edge by right triangular ligament. Still, we are continuing. ठीक है? So this is the diagram again, so that you can have an idea of all the surfaces. This is superior surface, this is anterior surface, this is posterior surface, and this is inferior surface. Let's move forward. We will talk about everything one by one. So first, we have a deep sulcus for inferior vena cava. Fine. We have this sulcus for inferior vena cava. Mostly cases में क्या होता है, this groove is covered by fibrous ligament. That ligament is ligament of inferior vena cava. So generally क्या होता है कि अगर सोचो ये ग्रूव है, ग्रूव के ऊपर अगर मैं ऐसे फाइबर्स पास वहां से हो रहे हैं, तो इट विल बिकम अ टनल थ्रू विच inferior vena cava is passing. सो जनरली ऐसा ही होता है कि वो एक टनल में कन्वर्ट हो जाती है. फाइन. सी, in most of the cases, this sulcus is roofed by fibrous tissue termed as ligament of IVC, converting it into the tunnel. Is it fine? Then we have visceral surface. Now, very important, the visceral surface is directed downwards, backwards, and to the left. So that is the visceral surface. We are talking about the inferior surface of the liver. Main thing, it is separated from the diaphragm. See, diaphragm is present anteriorly. Here we have inferior surface. So it is separated from the diaphragm or the anterior surface of the liver by this sharp inferior border. I already told you inferior border is sharp. तो जब हम स्पेसिमेन में भी देखते हैं, इट इज अ वेरी शार्प बॉर्डर विच डिमार्केट्स द एंटीरियर बॉर्डर एंड इंफीरियर बॉर्डर. दोनों के बीच में एक डिमार्केशन है. फाइन. इज इट गुड? चलें आगे. नाउ द विसरल सरफेस, द इंफीरियर सरफेस हैज अ fossa for gallbladder, a fissure for ligamentum teres, and it also has porta hepatis. So I'll show you. देखो, inferiorly it have this place. This is porta hepatis, यहाँ से enter करता है. This is the fossa for gallbladder, and there is one ligament fissure for the ligamentum teres here. Like for better explanation, you can see here also. This is the posterior surface. Still, you can see porta hepatis, this groove for gallbladder, and here we have fissure for ligamentum teres. Also, नीचे fissure for ligamentum teres होता है, ऊपर same. There is the continuation of this fissure, that is fissure for ligamentum venosum. If this is okay, can we move forward? ठीक है? Okay. Also, the whole visceral surface is covered by peritoneum except at the fossa for gallbladder. क्या होता है कि लिवर के साथ जो गॉल ब्लैडर है वो बिल्कुल पूरा कांटेक्ट में होता है. दैट्स वाई इस वाले पोर्शन पे, लिवर के इंफीरियर पोर्शन पे पेरिटोनियम की कवरिंग नहीं होती. बट जैसे यहाँ पे गॉल ब्लैडर प्रेजेंट है तो गॉल ब्लैडर के ऊपर कवर करेगा पेरिटोनियम, बट लिवर और गॉल ब्लैडर के बीच में कोई पेरिटोनियम नहीं. लाइक इफ दिस इज द गॉल ब्लैडर, दिस इज द गॉल ब्लैडर, तो यहां पे कोई पेरिटोनियम की कवरिंग नहीं होगी. फाइन. इज इट गुड? कैन वी मूव फॉरवर्ड? चलो. So now we are still talking about the inferior border. It separates diaphragmatic surface. हाँ, वो inferior surface था, ये border है, please. This is inferior border, that sharp inferior border I am talking about. So simple thing, वो visceral surface को diaphragmatic surface या पूरा वैसे diaphragmatic surface है, but anterior surface से उसको अलग करता है. इट इज राउंडेड लेटरली, तो जो इंफीरियर बॉर्डर है यहाँ पे राउंडेड हो जाता है. वाई? क्योंकि वहां पे जो डिमार्केशन है, देखो वैसे पूरे लिवर में कोई भी ऐसा बॉर्डर नहीं है जो बिल्कुल अच्छे से बता रहा हो कि कहाँ से एंटीरियर सरफेस आ रहा है, कहाँ से सुपीरियर आ रहा है, कहाँ से राइट लेटरल आ रहा है. वी डोंट हैव क्लियर डिमार्केशन. सिर्फ एक इंफीरियर बॉर्डर है जो बहुत शार्प है और बहुत अच्छे से बताता है कि यहां से मैं इसको डिफरेंशिएट कर. बट ऑल्सो ऑन द लेटरल साइड, जहां पे वो राइट लेटरल सरफेस को इंफीरियर सरफेस से अलग कर रहा है, यहां पे ये राउंडेड हो जाता है एंड बाकी मीडियली इट रिमेन्स शार्प. फाइन. और ये चीज मैंने पहले ही दिखाई थी. इस इंफीरियर बॉर्डर पे दो नॉचेस हैं. वन इज द सिस्टिक नॉच, जहां पे फंडस ऑफ गॉल ब्लैडर दिखता है, एंड देयर इज अ नॉच फॉर लिगामेंटम टीरीस which is located just to the right of median plane, just to the right of median plane, and this is 5 centimeter to the right of median plane. Is it good? चलें आगे. ठीक है. So this is just to the right of median plane, and this is 5 centimeter to the right of median plane. The fossa for gallbladder, or the cystic notch, and this is the notch for ligamentum teres. All good? चलें आगे. This also I already told you कि एपिगैस्ट्रियम में ये कैसे एक्सटेंड करता है. From the 9th costal cartilage on the right side and to the 8th costal cartilage on the left side. Fine. Now let us talk about the lobes of liver. Lobes of liver generally हमने दो पढ़ी. हमने पढ़ी एक राइट लोब होती है, एक लेफ्ट लोब होती है. वी आर वेरी हैप्पी विद दैट. ठीक है. बट अब हम पढ़ेंगे कि लोब्स ऑफ लिवर को डिवाइड करने के लिए दो तरीके हैं. पहले तो सो वन, वी आर गोइंग टू टॉक अबाउट anatomical lobes, and then we are going to talk about physiological lobes. Physiological मतलब functionally सेपरेट लोब्स. जैसे ब्रोंकोपल्मोनरी सेगमेंट्स हमने पढ़े. Bronchopulmonary segments that are present, they are functionally separate segments. बिल्कुल सेम तरीके से we have hepatic. सेगमेंट्स वी विल टॉक अबाउट। तो वो फिजियोलॉजिकल सेगमेंट्स हैं, वो फंक्शनली डिवीजन हुआ है। दिस इज एनाटॉमिकल लोब्स, दे आर एनाटॉमिकली डिवीजन। फाइन। सो एनाटॉमिकल लोब्स को डिवाइड करने के लिए वी हैव अ लाइन ऑफ डिमार्केशन। दैट लाइन ऑफ डिमार्केशन इज सिंपल, दैट इज divided by falciform ligament on the diaphragmatic surface. सो अगर हम एंटीरियरली या फिर सुपीरियरली भी देख रहे हैं, फॉल्सीफॉर्म लिगामेंट सुपीरियरली भी प्रेजेंट है, एंटीरियरली भी प्रेजेंट। सो सिंपली falciform ligament on the left side we have left lobe, on the right side we have right lobe, that's it. ठीक है। बट इफ वी रीच द visceral surface or even the posterior surface, we have four lobes, four divisions, anatomical divisions still। ध्यान से देखना। Here we have groove for inferior vena cava. On the inferior surface we have fossa for gallbladder. So this is a continuous line. ये schematic diagram है. So this is a continuous line. Then we have this fissure for ligamentum venosum continuing as fissure for ligamentum teres. Fine. And here we have porta hepatis। ठीक है। तो ये सारी लाइंस हैं। एंड नाउ यू कैन सी to the right side of this we have right lobe, to the left side of this we have left lobe, and between these two we have caudate lobe and quadrate lobe, and caudate lobe and quadrate lobe are separated by porta hepatis। Is it good? So these are the anatomical lobes that we divided। Fine. Should we move forward? Because now we have to talk about physiological lobes, functional lobes, true lobes। These are based on intrahepatic distribution of branches of bile duct, hepatic artery, portal vein। That means जो branches होंगी hepatic artery की, portal vein की, and bile duct की जो drainage होगी, they will be separate in separate lobes। Fine। नाउ फिजियोलॉजिकली जब भी हम लिवर को डिवाइड करते हैं, वी डिवाइड द लिवर इनटू टू, अप्रोक्सीमेटली टू इक्वल हाफ्स। जो कि एनाटॉमिकली जब हम कर रहे थे तो नहीं हुआ था। एनाटॉमिकली व्हेन वी वर डिवाइडिंग इट वाज 5/6 of the liver was constituted by the right lobe and only 1/6 was constituted by the left lobe। Is it okay? Does it make sense? Can we move forward? अपने आप ही हैंड रेज हो गए, छोड़, पढ़ने पे फोकस कर। ठीक है ना? देखो, नाउ व्हेन वी आर डिवाइडिंग द लिवर फिजियोलॉजिकली इनटू टू लोब्स, मैंने बोला कि ये ऑलमोस्ट इक्वल रहेगा, राइट? ऑलमोस्ट ये इक्वल रहेगा, राइट? तो मैं बता देती हूँ कैसे डिवीजन हो रहा है। एंटीरियरली व्हाट वी आर डूइंग, फ्रॉम द सिस्टिक नॉच we are moving upwards in a straight line till the inferior vena cava। So this is the line of demarcation। इधर से राइट लोब हो जाएगा और इसके लेफ्ट में लेफ्ट लोब हो जाएगा। दिस इज द होल लेफ्ट लोब। ठीक है। एंड पोस्टीरियरली व्हाट वी आर गोना डू, पोस्टीरियरली द सेम थिंग। पोस्टीरियरली इंफीरियर वीना केवा की ग्रूव थी और ये फॉसा फॉर गॉल ब्लैडर था, वहां से जाना है स्ट्रेट। बट प्लीज रिमेंबर जो कॉर्डेट लोब होता है ना, उसका पोर्शन लेते हुए जाना है। दैट मीन्स कॉर्डेट लोब इज इक्वली डिवाइडेड बिटवीन द राइट एंड लेफ्ट लोब्स ऑफ लिवर व्हेन वी आर फिजियोलॉजिकली डिवाइडिंग इट। फिजियोलॉजिकली तो जो कॉर्डेट लोब होता है वो इक्वली डिवाइड होता है between the left and right halves of the liver. Now talking about the segments of liver, तो ध्यान से सुनना. The right segment is divided into anterior and posterior halves. The left segment is like left lobe is divided into medial and lateral halves. ध्यान से. Anterior, posterior on the right side, medial, lateral on the left side. Now, if you divide everything into upper, lower lobes, segments. So we will have 8 segments in total, as you can see right here. Upper, lower, and upper lower. And we name them as first, second, third, fourth, like this. Fine. Then 5, 6, 7, 8, like this. So we are going in a clockwise manner starting from here and we are going like this. If this makes sense. Is it good? So in total we will have 8 segments, 8 surgically resectable hepatic segments. Also, the veins that are draining these segments will be intersegmental veins. जैसे bronchopulmonary segment में भी intersegmental veins ही थी. That means between the two segments a vein is present. That means this vein is draining more than one segment. If this makes sense, can we move forward? Got it? So the main thing is because liver की regeneration capacity बहुत अच्छी होती है, you can remove 80% of the liver from a person's body and वो still पूरा regenerate कर लेगा. If you are removing more than half, think about it. 80% is more than half. अगर more than half हमने निकाल भी दिया तो भी वो पूरा वापस से बन सकता है. Is it good? Should we move forward? This is a diagram from Grace. Okay, let's move forward. So, on the surface of liver, there is no identifiable demarcation between anterior posterior segments of right lobe. तो हमें नहीं पता कि राइट लोब को एंटीरियर और पोस्टीरियर में कैसे डिवाइड किया है. बाहर से कोई डिमार्केशन नहीं है. बट फॉर द लेफ्ट लोब जो इसको मीडियल और लेटरल में डिवाइड किया है, इसकी डिमार्केशन है. इसकी डिमार्केशन कैसे है? वी हैव fissure for ligamentum teres and ligamentum venosum on the back side, if you remember. On the posterior surface and inferior surface, we have fissure for ligamentum venosum, fissure for ligamentum teres. So that is the demarcation. I'll show you. डायग्राम देखते हैं, देख लेना चाहिए. This. So here. So ये यहाँ से जो आईवीसी और गॉल ब्लैडर है, यहाँ से हमने इसको पोस्टीरियरली ऐसे डिवाइड किया है. और मैंने बोला था कॉर्डेट लोब में से थोड़ा सा पार्ट हम लेके चलेंगे यहाँ से. देन दिस इज द लेफ्ट पार्ट, दिस इज द राइट पार्ट फिजियोलॉजिकली. सो लेफ्ट लोब is divided into medial and lateral halves. This is the medial, this is the lateral half. So वो divide करने के लिए there is a clear demarcation. We have fissure for ligamentum venosum and fissure for ligamentum teres. So this whole thing is medial, this whole thing is lateral. Also, as you can see, 1, 2, 3 and 4 ऐसे segments divide होंगे. हम पीछे से देख रहे हैं, प्लीज इसको ध्यान रखें. So first lobe is the caudate lobe and fourth lobe is the quadrate lobe. Also caudate lobe is considered as a separate lobe sometimes क्योंकि caudate lobe का अपना पूरा drainage और supply चल रहा है. Arterial supply, venous drainage, everything is very different. There are two names जो मुझे बताने. एक तो वो लाइन ऑफ डिमार्केशन जिससे हमने फिजियोलॉजिकल लोब्स को राइट और लेफ्ट में डिवाइड किया था, दैट इज अ प्लेन और लाइन, कैंटलाइज प्लेन, बिकॉज ही कांट लाई, सॉरी, कांट लाई, कैंटली, वट एवर, आई डोंट नो, जो जो मर्जी बोलो। एंड सेगमेंट्स की नॉमेनक्लेचर के लिए ऑल्सो वी हैव अ नेम, अ पर्सन, दिस वन, कोइनॉड्स सेगमेंट्स। दिस इज द पर्सन जिसने नॉमेनक्लेचर किया, सारे सेगमेंट्स को डिवाइड किया। फर्स्ट सेगमेंट इज कॉर्डेट लोब, फोर्थ इज क्वाड्रेट लोब, जो कि मैंने अभी बताया था। Also, the whole of the left side is supplied by left branch of hepatic artery, portal vein, and drained by left hepatic duct. And on the right side, they are all supplied by right hepatic artery, portal vein, and drained by right hepatic duct. If these things make sense now, so let us move forward because we have to talk about peritoneal relations, जिसमें पूरा लिवर पेरिटोनियम से कवर्ड है एक्सेप्ट फॉर द बेयर एरिया, फॉर द फोसा ऑफ गॉल ब्लैडर, फॉर द ग्रूव ऑफ इंफीरियर वीना केवा, groove for ligamentum venosum, and porta hepatis, the things that are entering or exiting. These things are also not covered by the peritoneum. Because if you remember, lesser omentum के right free border में ये तीनों चीजें present होती हैं. The hepatic artery, portal vein, and hepatic duct. So they are also not covered by peritoneum. So now we are going to talk about these peritoneal folds. Why? Because they are forming false ligaments. So if we are talking about ligaments of liver, हम पढ़ेंगे false ligaments of liver and true ligaments of liver. False ligaments are not actual ligaments because they are actually peritoneal folds. वो पेरिटोनियम की रिफ्लेक्शन से पेरिटोनियम फोल्ड हो रहा है. द ट्रू लिगामेंट्स विल बी लिगामेंट्स क्योंकि वो किसी एम्ब्रियोनिक स्ट्रक्चर का ऑब्लिटरेशन होगा. सो फर्स्ट वी आर टॉकिंग अबाउट फॉल्स लिगामेंट्स which are not ligaments, they are actually peritoneal folds, we just call them ligaments. काम तो कर ही रहे हैं ligament जैसा. So first of all we have falciform ligament, coronary ligament, right triangular ligament, left triangular ligament, and lesser omentum. If you want to see, I'll show you falciform ligament and lesser omentum from the chapter of peritoneum itself. एक बार यहां से देख लेते हैं, बेटर रहेगा, है ना? So what are we talking about? Falciform ligament and lesser omentum, right? So let's find out. So here is the lesser omentum. If you can see, this is the lesser omentum that is attaching on the stomach. If you can see, to the abdominal part of esophagus, lesser curvature, and the initial 1 inch of the duodenum. Is it fine? But on the liver, it is attached to, I'll show you. So on the liver, it is attaching in a J-shaped manner. I'll take another diagram here. Like, can you see the J shape? This is the J shape that I'm talking about. Is it good? तो ध्यान से सुनना, ये जो J shape है, it has two components, a vertical component, a horizontal component. तो जो ये वर्टिकल वाला पोर्शन है, इट इज अटैचिंग टू लिगामेंटम विनोसम. जो फिशर फॉर लिगामेंटम विनोसम था, वहां से ये अटैच हो रहा है. एंड दिस हॉरिजॉन्टल पार्ट इज अटैचिंग टू द मार्जिन्स ऑफ पोर्टा हेपाटिस. If it is good, I'll tell you something, that in the right free margin of lesser momentum. Here we have the three things that are entering or exiting. See, these three things. Can you see? ये है hepatic duct, portal vein, and hepatic artery. So these three things are present in right free margin of lesser momentum. That's what I wanted to tell you about lesser momentum. Now moving on to the falciform ligament, which is a sickle shaped ligament. आई होप मैंने मिस नहीं किया, नीचे तो नहीं चला गया? चला ही गया होगा। चलिए, I'll show you the falciform ligament because it is a sickle shaped ligament here nicely. Falciform ligament, this is the superior surface of liver, anterior surface of liver. So दोनों को अटैच कर रहा है। ये किससे अटैच कर रहा है? डायफ्राम से अटैच कर रहा है एंड एंटीरियर बॉडी वॉल से अटैच कर रहा है अप टू द लेवल ऑफ अम्बलाइकस. So that's the main thing you need to remember. So it is attaching superior and anterior surface of liver to the diaphragm and anterior body wall up to the level of umbilicus. It is a sickle shaped ligament. So ये दोनों ligament बहुत importantly मैंने दिखाने थे पेरिटोनियम से. So we are done with that. Now let us move forward in this chapter. ठीक है, तो देखो falciform ligament we have already done. Now we have coronary ligament, which is a triangular fold of peritoneum and it connects the bare area of liver to the diaphragm. So bare area क्यों बोलते हैं? क्योंकि उस पे कोई पेरिटोनियम की कवरिंग है ही नहीं. फर्स्ट थिंग. सेकेंड थिंग, क्योंकि उस पे कोई पेरिटोनियम की कवरिंग नहीं है, इट इज इन डायरेक्ट कॉन्टैक्ट विद द डायफ्राम, विच इज अगेन क्लिनिकली ऑल्सो इंपॉर्टेंट. ठीक है, सो लेट्स टॉक अबाउट द कोरोनरी लिगामेंट. देखो, हियर वी हैव द कोरोनरी लिगामेंट. अगर हम इसके अपर पार्ट की बात करते हैं, so this upper portion of the coronary ligament, when we are looking at it, it is reflected from the diaphragm to the liver, and the inferior layer is reflected from the renal kidney to the liver. So these are the reflections. ऐसे पेरिटोनियम है, फोल्ड ही हो रहा होगा ना, इफ दिस मेक्स सेंस टू यू. ठीक है, अगर हम इसको राइट तक एक्सटेंड करेंगे तो ये दोनों मिलके राइट ट्रायंगुलर लिगामेंट बना लेंगे. एंड इफ वी like trace it to the left side, this upper part of this coronary ligament becomes continuous with the right part of falciform ligament. Can you see? Like दो है ना falciform ligament, so it becomes continuous with the right part of falciform ligament, and the lower one it becomes uh, like it reflects over the caudate lobe. So क्या लिखा है एक बार देख लो. सो व्हेन ट्रेस्ड टू द राइट साइड, जब इनको ट्रेस करोगे तो ये ट्रायंगुलर लिगामेंट बना लेंगे. लेफ्ट साइड पे ट्रेस करोगे तो अपर लेयर कंटिन्यूअस हो जाएगा टू द राइट लेयर ऑफ फॉल्सिफॉर्म लिगामेंट एंड लोअर लेयर विल बिकम कंटिन्यूअस विद पेरिटोनियल रिफ्लेक्शन अलोंग द राइट बॉर्डर ऑफ कॉर्डेट लोब. ये राइट बॉर्डर ऑफ कॉर्डेट लोब के साथ कंटिन्यूअस हो जाएगा. इज इट गुड? सो कोरोनरी लिगामेंट ये पूरा है. ये 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 भी कोरोनरी लिगामेंट ही है. ऑन द लेफ्ट साइड व्हेन इट इज ट्रेस्ड, ये दोनों मिलके लेफ्ट ट्रायंगुलर लिगामेंट बनाएंगे. सो राइट ट्रायंगुलर लिगामेंट आई ऑलरेडी टोल्ड यू. Left triangular ligament is a very small fold which connects the upper surface of the left lobe of liver to the diaphragm. Is it good? तो अगर हम इन दोनों को राइट साइड की तरफ ट्रेस करते हैं, सो दिस अपर part of coronary ligament becomes continuous with the left layer of falciform ligament, and the lower part of coronary ligament becomes continuous with the fissure of ligamentum venosum, if this makes sense to you. Is it good? Fine. That's what is written here also. On this side, it becomes continuous with anterior layer of lesser omentum also. Do you remember J shape, this J shape, जहाँ से lesser omentum attach हो रहा है. So here is lesser omentum. You can see इसकी एक vertical limb है और एक horizontal limb. The vertical limb attaches to the margin of fissure for ligamentum venosum, and horizontal limb attaches to the margin or lips of porta hepatis. If this is good, let's move forward. We have true ligaments now, और ये मैंने बोला भी है, these are the remnants of fetal structures that we already know. Ligamentum teres hepatis is obliterated umbilical vein, and ligamentum venosum is obliterated ductus venosus. If this is good, ये चीज हम पहले कवर कर चुके हैं in the lecture of heart formation, embryology. Fine. So now coming to the relations, we will talk about 5 surfaces, relations of all 5 surfaces. Starting with the superior surface, it is very easy. Superior surface is all in contact with the diaphragm. So superior surface will have relation with the right dome of diaphragm, left dome of diaphragm, and the central tendon of diaphragm, which is separating the liver directly from the heart, the pericardium of the heart. That's why this area is marked as cardiac area. Good. Now, coming to the anterior surface, you can see anterior surface is also related to same 3 things. Is it good? Right dome of liver, left dome of liver, cardiac area, that means the central tendon. And on the right side, it is also related to the lungs, the right lung and right pleura, right? And the recess, the costodiaphragmatic recess of the pleura, and the ribs also. Fine. Then we have posterior surface. So from the back side, the posterior surface is related to esophagus, stomach, and this thing, kidney. On the right side, right kidney and right suprarenal gland. Is it good? So same thing on the inferior surface, that is the visceral surface. You can see esophagus, gastric area, this suprarenal area, and duodenal area, and colic area. So that means the duodenum is present here. If duodenum is present here, that means this lobe, quadrate lobe, is related to pylorus of stomach. Right? So the pylorus of stomach continuing as duodenum, and then this is the colic flexure, right colic flexure. Make sense? Can we move forward? Is it good? Okay. Very importantly, talking about the relations of right lateral surface. So this right lateral surface is related to diaphragm, opposite to 7th to 11th ribs. Now, please think about it. We are talking about mid-axillary line. What is the extent of lungs and pleura in mid-axillary line? Think about it. For lungs, it is 8th rib. For pleura, it is 10th rib. So if this makes sense, Right lateral surface we will divide into three parts. Upper one third, middle one third, lower one third. Where upper one third is related to both lungs and pleura, because lungs and pleura both are present up to 8th rib. Pleura 10th rib तक extend कर रहा है. Fine. So middle one third will be related to the costodiaphragmatic recess of pleura, and lower one third of the liver, the right lateral surface of liver, is related to 10th and 11th ribs. If this is okay. So if we want to do the needle biopsy of liver, if we want a tissue sample from the liver, we can go through the 9th or 10th intercostal space, so that we don't like injure the lungs. So we can go from here to reach the liver, take a sample. This is the needle biopsy of liver. All good? Should we move forward? Done. So talking about porta hepatis, that is the gateway of liver, I already told you. It is a horizontal fissure on the inferior surface of liver between the caudate and quadrate lobe. If you remember, caudate and quadrate lobe are divided by porta hepatis only. So in the porta hepatis, right and left branch of hepatic artery is entering. Right and left part branch of portal vein is also entering, but right and left hepatic ducts are leaving the liver. Got it? And the arrangement of vein, artery, and duct from posterior to anterior is like posteriorly we have vein, and we have artery, and then we have duct. Fine? Is it good? Can we move forward? So we are almost at the last of the lecture, end of the lecture. Bye. So talking about the blood supply, it is very easy. Oxygenated blood is entering the liver by hepatic artery. Deoxygenated blood is entering by portal vein. In lying down position, recumbent position, one third of the whole cardiac output is reaching the liver, passing through the liver, out of which 80% is passing through the portal vein and 20% is passing through hepatic artery. All good, all done. Venous drainage, simple. We have left hepatic vein, middle hepatic vein, right hepatic vein, all of them draining into inferior vena cava. But the left hepatic vein is present between medial and lateral segments of the left lobe. Right hepatic vein is present between anterior posterior segments of the right lobe, and middle hepatic vein is present between the right and left true lobes. They all are going to drain in inferior vena cava. Fine. Also, middle hepatic vein is present in the sagittal plane because it is dividing the right and left true lobes. So it is of great radiological significance, ultrasonographic significance, because this vein will be present between the two lobes. It will be a good demarcation. Got it? Let's move forward. Several small accessory veins, including a separate vein from caudate lobe, emerge in the lower part of groove for IVC and open directly into the IVC, inferior vena cava. Talking about the lymphatic drainage, we have superficial lymphatics and deep lymphatics in liver. Superficial lymphatics are present in the capsule of the liver. Deep lymphatics are present inside the liver, inside the portal triads. We will talk about it. No, not, yeah, passing through the portal triads. Is it? It must be. Let's talk. Superficial lymphatics in the capsule of liver from posterior aspect and from anterior aspect. Very easy. Posterior aspect, they will converge towards the bare area and then they will try to go upwards. They will communicate with the extraperitoneal lymphatics, perforate the diaphragm, drain into posterior mediastinal lymph nodes in the thorax. But from anterior aspect of liver, everything, the lymphatics are going to drain in hepatic nodes. If you remember them from the lecture of stomach. So hepatic nodes, and these will drain into celiac nodes ultimately. Also, gallbladder is also drained by the hepatic nodes that are 3 to 4 nodes present in porta hepatis itself. Then the deep lymphatics that are accompanying the portal triads that I already told you. So these deep lymphatics will form two trunks, the ascending trunk and the descending trunk. Ascending trunk going upwards, descending trunk going downwards. So obviously it will be emptying in hepatic nodes, and ascending trunk will enter the thorax through the caval opening, vena caval opening, and they will terminate into the nodes that are present around inferior vena cava. That's it. Moving on to next, the nerve supply. We have parasympathetic supply from anterior vagal trunk and the sympathetic supply through which the pain will pass. The pain that is occurring due to distension of hepatic capsule, hepatic peritoneum due to inflammation and swelling of liver, that is hepatitis, runs along the sympathetic fibers that are going through the sympathetic chain, and the pain can be referred to the epigastrium and sometimes to the shoulder also. Got it? Simple, the factors keeping liver in position. Liver इधर उधर नहीं जाएगा क्योंकि there are hepatic veins जो liver को IVC से connect करेंगी. The intra-abdominal pressure that is maintained by anterior abdominal wall, muscles, and peritoneal ligaments that are connecting the liver to the wall, the abdominal wall. All good? Should we move forward? Now, talking about the microscopic structure, I'll not tell you more about this, but still you can see there are some hexagonal lobules. Show you the diagram. See, these are the hexagonal lobules. At each corner of this hexagon, you have this portal triad. Like there will be some connective tissue in which portal triad is present. Portal triad में क्या होंगे? वही तीन चीजों के smaller versions. Do you get this? Like the hepatic arteriole, portal venule, and hepatic ductules. Fine. Also, in the center of each lobule, you will have central vein. Is it good? So there is a vein, portal venule, there is a vein, central vein. Blood किस direction में flow कर रहा है? Blood is flowing from the portal venule to the sinusoids to the central vein, like from here to here, like the sinusoids, as you can see, and to the central vein. That's how things are happening. And in the lobules, you can see cords of hepatocytes radiating, and between the hepatocytes, you have these spaces that are sinusoids. Is it good? Can we move forward? So we have this, the arrangement of different hepatic lobules. Here I want to tell you about two things. One is hepatic acini, which is this diamond-shaped area which is including parts from two hepatic lobules and with portal triads on each side, like the side of the elliptical area, and on each corner or each end, there are central veins. Then we have portal lobule, which is a triangular area including parts of three hepatic lobules connecting three central veins. And in the center, you have portal triad. And that's it. Cirrhosis of liver is the clinical correlation that you already know. जो लोग alcohol बहुत ज़्यादा consume करते हैं, their liver becomes fibrotic, and that is known as cirrhosis of liver. Fine. What happens in cirrhosis of liver is the resistance to blood flow through cirrhotic liver will increase. There will be a resistance to the blood flow, which will lead to increased pressure in the portal veins in the radicals. And since the portal vein and its tributaries are devoid of valves, the increased venous pressure will cause distension of all its tributaries. They will distend. Got it? And that is portal hypertension caused by cirrhosis of liver. And that's it. That was all about liver. So we'll meet again in another lecture. Till then, tata, bye bye, take care.